I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with the Whitford Thomas Group to speak to you today about major depressive disorder symptoms. Depression is one of the major blocks to happiness. The other three are anxiety, anger, as well as guilt. So depressive disorder or depression is a mood disorder. Then we have major depressive disorder. It's a more exaggerated depressed symptom. So the major difference between a major depression and just a depression is the same type of symptoms, you just see a much more elevated response. With people who have major depressive disorder, oftentimes you see a lack of energy, fatigued, oftentimes difficulty with eating, sometimes overeating, difficulty with sleep, oftentimes an insomnia. Other symptoms associated with a major depression or depression would be the inability to concentrate, to focus. With depression, and major depression is the same, there's a sense of hopelessness and helplessness. And so the idea is the hopelessness is that there's not anything I can do about making change in my life. And the helplessness, or first of all, the hopelessness is that things are not going to get better. And the helplessness is there's not anything I can do about it. So an individual with a major depression or depression has a very difficult time getting motivated to make change. What you tend to see a lot with major depression is people tend to kind of stop doing. They oftentimes end up not showing up to work, begin to see friends less and less, don't tend to interact with family and children, and basically kind of cop out, tend to kind of check out. Oftentimes with major depression too, there's thoughts of ideation of suicide. Some even make plans to take their lives. So the symptoms of major depressive disorder are pretty severe. They're the same symptoms as depression, it's just the behavioral component tends to be much more elevated. I'm Dr. David Thomas, speaking today about the symptoms of major depressive disorder.